The WeRPN Workplace Violence Prevention Toolkit, Module 6, Teamwork, developed by WeRPN with the support of the Government of Ontario. This module includes an overview of teamwork, barriers to teamwork, and RPN contributions to the team. Teamwork. RPNs often work in teams. The way that teams function is integral to how individual members of the team respect and treat each other. Many organizations have used various frameworks to identify the importance of collaboration. An example of this would be the Sunnybrook Framework of 2022 of the core competencies of interprofessional team collaboration. Communication, being able to understand each other when communicating across roles and professions. Reflection, the ability to self-reflect on your actions and be able to identify areas for improvement. This will impact the persons involved, allowing for a more positive outcome. Role clarification. Ensure that members understand each other's roles, scopes, and expertise. They explore interdependencies between their roles and optimize each member's scope with consideration of repetition and redundancies. Barriers. One of the biggest barriers to RPN functioning within a healthcare team is a lack of understanding of the RPN role. In some cases, the RPN role has been described as a personal support worker. Even with the scope of practice changes in July of 2023, in many organizations, RPNs are still not practicing to their full potential or scope of practice. This is typically due to a lack of understanding of the RPN role. RPNs must use their assertiveness to help others understand the value that the RPN brings to the healthcare team. RPNs work in collaboration with other members of the healthcare team to ensure high quality care is provided. Teams work most effectively when they have a clear purpose, good communication, coordination, protocols and procedures, and effective mechanisms to resolve conflict when it arises. Role clarity regarding the role of the RPN can reduce the potential for bullying and harassment. WeRPN resources to support role clarity for the RPN include the e-learning course, Optimizing Scope of Practice for RPNs. This course will provide all nurses with an understanding of the factors that support or hinder utilization of RPNs and strategies to optimize their scope of practice as valued members of the interprofessional team. The WeRPN Synergies Report is intended for use by leaders of nursing teams, nursing faculty, and RNs and RPNs in all practice settings. This concludes Module 6.